Hello there, this is Dr. Moyer, and we will be discussing family policy in this PowerPoint. So your policy assignments are actually due fairly quickly, and there are guidelines on D2L regarding how to do those, but I wanted to give you a introduction to policy so that you feel a little more comfortable with it. So when you hear the word policy, what do you think? Most people get freaked out by policy and freaked out by any type of assignment that involves using policy. I don't want you to be freaked out. Policies really, they're not scary, and they guide almost everything we do in our life. There's some kind of policy for everything. And it's just important to understand what the policies are when they affect you directly. And as a family professional, you're going to want to be familiar with the policies that affect the clientele you work with. That can seem daunting and overwhelming, but I don't want for you to think of it that way. It's not necessary that you know every single thing about a policy. What's necessary is that you generally know what the policies are that you have to work with, and then where you can get more information about them. So if you do need to know some more detail, you can get to that. And I'm going to help you with that. So hopefully that kind of takes some of the mystery away. What is policy? The development, enactment, and implementation of a law, rule, or code in both the public and private sectors. So here are some examples. Classroom policies. We always have some type of policy to abide by for the classroom, whether it's online classroom or face-to-face. Employment policies regarding things like when you can take a break, whether you have to punch in, time off, training, orientation, etc. Parking policies. If you drive to campus, that affects you. Where can you park without getting a ticket? Grading policies, so how are grades determined in a class? Speed limits, how fast can you drive? The legal drinking age, the age that people are allowed to vote. Rules regarding voting. Laws regarding public education, for example, No Child Left Behind. Laws regarding who's eligible for some type of welfare and cash assistance, otherwise known as temporary assistance for needy families, and who's eligible for assisted health care like Medicaid or Medicare. All of these are examples of policies. They don't have to be big and fancy to be a policy. They just have to be some type of law, rule, or code. So, who makes these policies, though? Who gets to decide? Well, the people that make the policies are the policymakers, and they make them at many different levels. And so sometimes you are the policymaker when you're voting on an issue that could become a policy or is being altered in some way. That happens quite often. But generally, anyone that makes those rules or laws, so it can be the legislature, the people that we vote into office to decide those things. It can also be the president. It can be the teacher. It can be your boss. It can be the mayor. It can be anyone, really anyone that just decides these. So although when we think about the legislature, that does seem like a fancy title for policymaker, really just think about it as people that have to make the laws and rules. And they're the ones that should be sweating about policy because they have to know the ins and outs and vote on whether or not a policy is going to pass. That's much more stressful. Okay, so then typically I like to add the so what factor. Why should we, as family and consumer science professionals, care about public policy? So, in other words, why do we even talk about it? Who cares? Well, we're all going to be working in areas that interface with individuals and families. That we know. And all of these areas, regardless of what area you're talking about, are affected by public policy. So if you were in financial literacy. You deal with identity theft policy, lemon laws for cars, policies on whether or not a car, what disclosure acts about the car, or even disclosure acts about your credit, trade policies, etc. If you're in merchandising, you're dealing with textile labeling laws, whether fabric is flammable or not, and what you have to list, and how the care is required on the garment. Shoplifting laws. If you're in dietetics, there are dietary guidelines. MyPlate.com is an example of policies being implemented. There's safe food handling policies, food temperature, dietary supplements, school lunch, WIC, women, infants, and children, and family services, all across the board, so many policies, assistance for needy families, public education, family violence, medical insurance for the poor, marriage, divorce, adoption, child abuse, elder abuse, partner abuse. And in the aging area, although not a separate discipline, it would fall under family services, but specifically you deal with things like long-term care policies. So no matter what career you choose, you will be affected by policy. And that means that you need to be in a position to be able to evaluate policies, and you have to know how to apply them as well. The other part of why we should care, so not just as FCS professionals, but as individuals in this country, we are all affected by policies. And so we're affected on a personal level. And I can argue that literally every single policy has an effect on you, even if it's an indirect effect. So although it may seem like it's not, policies about, let's say, where toxic waste is stored, may not seem like a family policy, but it is, because if it's stored in a neighborhood where it's going to affect the people that live there in regards to their health, then it becomes a family issue because the family is affected by the toxic waste. And that is a problem, and it's something that maybe doesn't affect you, but if you know somebody, or you work with people, or you work for people that are in this area affected by the toxic waste, then it becomes your problem more directly. Another side to public policy and why we should care is because public policies are about handling social problems, and families contribute to social problems. We try to avoid that. Of course, our purpose is to improve the quality of life for individuals, families, and communities. But as we're probably aware, families contribute to some of the problems that we have to manage and contain and deal with. So family traits, rituals, habits, beliefs, all of this contributes to social problems. Nutritional patterns, how families are eating, what they eat, what the characteristics for meals are within families can lead to things like disease and disability that end up becoming a social policy problem, because we have to provide support for people that go on disability, permanent disability, or suffer from disease and don't have, or do have actually, health insurance, because it affects the cost of health care. Family dysfunction, spousal and child abuse, divorce, all of this can lead to less productive citizens. And so we do care about this as well, because if families aren't functioning in a healthy manner, then that means individuals can be affected. And if they're not productive citizens, then the country's not running as smoothly as it could. Poor spending habits, debt, bankruptcy, overspending. Ultimately, we have to pay the cost as taxpayers when this happens. So when you're thinking about who cares, it's okay. It's just one of my kitties. They are growling at each other, but they're okay. So people disagree about whether or not these are people problems or government problems, or even what role government should play in family life. And although it's something we could debate, that's not really what the focus of this lecture or this lesson is even on. Should support for families be provided by the government? Well, when you ask most people, they will say that family is the most important aspect to their life. If they have to list things in order, they'll say, it's all about family. Role of families is to prepare the next generation to become productive citizens. And so the next generation affects everyone, whether or not you have children or not. Are families a personal matter then, or a proper target for policy making? Well, what is clear is that support for families can be affected by the government. So the government can create the conditions under which families do best. And that's where we come in. As family and consumer science professionals, we're concerned with how can families thrive and do best. And that is something that's a role that the government has. So we do research on issues, protective factors, risk factors, programs, eating, garment, wear, housing, textiles, financial literacy, etc. And we want to make sure that our research is used to improve the lives of families, usually in a very direct manner. We also use this information to inform policymakers. So there are many FCS professionals that create policy briefs or handouts that they give to policymakers so that they can be aware of what the current research is and they can make informed decisions when voting on policy. And that's why we have to be able to evaluate policies as well. So the assignment that you guys have regarding public policy is to find a movie or a film that deals with some type of social issue or problem, and then find a policy that corresponds with that problem. And then you're going to evaluate the policy and make recommendations for improvement. And believe me, there's always room for improvement. Sometimes people say, oh no, it's got everything. And I always say that's not possible. So there's always recommendations that can be made. What are the conditions under which families do best? Well, we know that they need support. We know that they do best when they have a high quality of life, and that includes in the areas of nutrition, housing, family functioning, food quality, caregiving, clothing, transportation, hospitality, restaurants, communication, financial literacy, etc. So these things get translated into policies that support these areas. And that's where our role once again comes in. Hopefully that makes sense. If you're looking specifically at family policy and a definition of family policy, there are some things that researchers say that define public policy. Any policy that focuses on at least one of these 4 family functions: creation, support, or economic support, child rearing, family caregiving. So marriage and divorce laws affect family creation, adoption laws, child care, child discipline, etc. Economic support, the temporary assistance for needy families provides support for families that are in a situation where they can't support themselves due to being laid off or unemployed or dealing with some other type of barrier. Also the Social Security Act, anything where economic support is provided. So even the Unemployment Act, any type of policy, disability, etc. Child rearing, socializing the next generation. So clearly this involves education. It also involves discipline, problem solving, social skills. So any type of policies that deal with those. For example, Child Abuse and Prevention and Treatment Act is one. And then family caregiving. So caring for one another physically and psychologically. And this can, so any policy that deals with that aspect, like the Older Americans Act, or even living wills, anything that can help us to make sure we provide adequate and good care. But again, I would say that every policy affects families, so even if they don't deal with one of those functions, they may not directly be labeled as a family policy, but they affect families. So how do we evaluate family policies? And there are basically three main questions. Does the policy have the desired effect? Does it do what it's intended to do? Are there any unintended consequences? And this can include both positive and negative unintended consequences. And how does the policy affect all families? So when looking at whether or not it has the desired effects, you have to look at the goal of the policy. What is it supposed to be doing? And then whether or not it's actually doing that. And usually we rely on research to find that out. So we look to see if the Violence Against Women Act is actually effective at reducing violence against women, for example. Or we look at the No Child Left Behind Act to see if it is actually improving test scores for children in the United States. Or we look at, any policy. Temporary assistance for needy families. Is this helping to reduce poverty? Then we look at unintended consequences, and again, usually we're looking at research for this. You can't just assume or guess. So what kind of positive things weren't anticipated but happened as a result of implementing the policy? What kind of negative things weren't intended, weren't thought out ahead of time, but did happen as a result of implementing the policy? So, for example, when the Welfare Act was changed in 1996, one of the provisions of that was in order for women to receive temporary assistance for needy families or cash assistance, they had to be able to name the father of their children that were going to be supported by the cash assistance. And while that seemed like a good idea for the government to be able to go after the person responsible for providing cash assistance rather than the government, it did put women that were in violent relationships in danger, because by having to name the father, then they alerted the father to their location, which then put them in danger. So that wasn't intended, but it did happen. So the policy had to be amended over time. And then looking at how does the policy affect all families, you can't just look at the kind of families that maybe the government approves of or that are legally defined as family. People define family, and they determine who their family members are. And so as FCS professionals, we support all families. We don't just support certain families. And so you have to look at whether or not the policy is helping everybody, or is it only helping people, for example, that are allowed to be legally married. So before the same-sex marriage law was passed, then you could potentially say, well, if same-sex couples can't get married, they're not legally a family. But long before that law was passed, FCS professionals were supporting same-sex couples and their children because, again, people define family, and we support all families. We're not in the habit of defining what is a family. We're just in the habit of supporting all families. So more on the unintended consequences. So this is just kind of an example I typically give in class. If you to look at policies that are aimed at reducing obesity, there are oftentimes three kind of lines of research: nutrition labeling in restaurants, taxing snack foods, and putting restrictions on food advertising aimed at children. And so if you're looking at what some unintended consequences are, consumers, so taxing snack foods, consumers may choose healthier foods to save money, but the burden of this tax could fall disproportionately on low-income consumers, who actually, according to the research, spend more of their income on food than do middle or upper income consumers. So there's an unintended consequence. putting the tax on people that really can't afford it. Nutrition labeling. So it could improve food choices by consumers if they know what the calorie content, nutritional value, etc. However, restaurants offering healthier choices oftentimes offer them at higher costs than less healthy choices, leading to consumers still opting for the less healthy choice. So by requiring labeling, restaurants are themselves more aware of what's a healthy option, and they can charge more. Food advertising to children. The idea, of course, if they're not exposed to ads promoting candy, soft drinks, sugary cereals, etc., they may not want them as much. However, the unintended consequence, lower prices on those types of foods due to lower advertising costs, may result in increased consumption. So the cereals wouldn't be as expensive, making them more accessible to families, and children may consume more. Hopefully that makes sense. There are things, again, that you didn't intend, but they happened anyways, and now we have to oftentimes go back to the drawing board and think about how can we make this policy more effective. So that is how policies are evaluated and what family policy is, who the policymakers are, and the whole purpose. Policies are created to help families be able to do the best job possible raising the next generation. And we as FCS professionals are in a position to help policymakers determine whether or not these are good choices, good steps, or not. And that is all.